Well, thank you all for joining us for today's webinar. My name is Dr. Savannah Clary, and I'm part of the clinical team here at Aegis. Today, we'll be discussing medication adherence testing in behavioral health and substance use disorder. This is certainly a topic that we could dive into very deeply and talk about many related areas, such as assessment of patient risk and how that contributes to monitoring decisions. In this brief session today, I want to introduce you to some available tools that you might not be aware of and describe how they can assist with clinical decision making. After today's webinar, participants should be able to describe adherence rates for common mental health diagnoses and risk factors for non-adherence, explain the testing options offered within Aegis's AcuRiseID, discuss the role of medication adherence testing in differentiating between non-adherence, treatment failure, and symptom progression, and understand how appropriate utilization of additional definitive testing tools can assist with clinical decision making. As a pharmacist, this diagram is very intriguing to me. I have spent time working in a community pharmacy, and of course, we would like to believe that patients are coming right over from the doctor's appointments with their new prescriptions, getting them filled, and starting to take them exactly as prescribed and refilling on time. Unfortunately, that is not the case, as is demonstrated by this data. So for every 100 prescriptions written, so if we start at the far left and kind of follow this across, for every 100 prescriptions written, only 50 to 70 or so are filled at the pharmacy. Maybe transportation barriers or schedule conflicts that prevent them from going to the pharmacy during their operating hours to pick up. Then only 48 to 66 are picked up from the pharmacy. Again, could be similar barriers that prevent them from taking the prescription to be filled and add possibly out-of-pocket cost barriers to this list as well. Only 25 to 30 prescriptions are actually taken properly. All sorts of things could be contributing to this, such as side effects or disbelief in effectiveness or disbelief in the necessity of the medication. And then only 15 to 20 are refilled as prescribed. And we think about the cycle of adherence barriers repeating itself all over again. Both prescribers and dispensers would like to believe the best when it comes to adherence, but sometimes patients don't maintain the necessary adherence level for therapeutic effectiveness. While the required adherence level for some medications is very high, such as oral contraceptives, for example, requires very high adherence. It's estimated that about 80% adherence is required for therapeutic effectiveness of behavioral health medications. Looking at adherence, there are groups of people with mental illness diagnoses who tend to be more non-adherent than others. This is a variety of sources that are pulled together to provide these estimates, but for anxiety disorders, the adherence rate is estimated to be 57%. For depression, the estimated adherence rate is 28 to 52%. For schizophrenia, it is 10 to 76%. For bipolar disorder, the estimated adherence rate is 20 to 66%, and for ADHD, it is estimated to be 13 to 58%. Many risk factors for non-adherence have been described in the literature, including young age, a low level of education, male gender, low socioeconomic status, substance abuse or dependence, social or environmental factors, medication-related factors such as adverse effects, and psychological factors such as cognitive impairment, poor insight, and denial of illness. There is additional data showing non-adherence can be as high as 60% in the setting of co-occurring mental illness and substance abuse. This can lead to symptom recurrence, increased risk of hospitalization or incarceration, and premature death or suicide. As mentioned earlier, at least 80% adherence is needed to achieve optimal therapeutic efficacy in the treatment of behavioral health disorders. When non-adherence and related poor outcomes occur, this exacerbates an already huge financial impact with an estimated $193.2 billion in lost earnings each year attributed to mental illness-related impacts. Researchers in psychiatry sought to obtain expert clinical opinions and develop a consensus recommendation regarding use of urine testing in assessing adherence to antipsychotics among people with serious mental illness or SMI. They reviewed literature and conducted interviews with clinicians to develop these recommendations. The participants were working at community mental health centers, and had considerable experience using urine monitoring for antipsychotic adherence. A total of 13 articles and 4 unpublished reports were reviewed, and 13 clinicians across 9 community mental health centers were interviewed. These mental health centers were in 6 different states. 9 individuals were invited to participate in an expert panel, of which 4 physicians agreed to participate, representing 4 mental health centers in 4 different states. The consensus provides information on appropriateness, impact, and feasibility of urine monitoring for antipsychotic adherence at different time points along the patient's treatment course or when certain conditions are met. For example, at initial intake, monitoring could be considered for patients presenting with symptoms of serious mental illness or SMI with no established diagnosis, patients with diagnosed SMI who have a risk factor for poor adherence or who are homeless, SMI plus co occurring substance use disorder, or geriatric patients with SMI. Additional recommendations are also provided regarding patient education, discussing testing results with patients, and then ongoing monitoring decisions as well. Aegis offers medication monitoring solutions tailored for mental health and substance use disorder treatment with AcuRiseID testing options. These tools provide objective, clinically actionable information related to medication adherence, substance abuse, and drug-drug and drug-food interactions, depending on which testing solutions are incorporated. This is accomplished through definitive testing of urine and oral fluid specimens via liquid chromatography and tandem mass spectrometry. These testing options are customizable with choices of profiles and or a la carte options as well. Objective assessment of substances in urine or oral fluid eliminates barriers to identifying accurate medication lists and adherence, which can include reviewing prescription monitoring databases and refill histories, pill counts, incomplete or inaccurate individual recall by the patient regarding their medications, assessing medication changes at different levels of care and with transitions of care, and identifying non prescription substances as well. Some additional advantages to Aegis testing are that it can be incorporated into the patient's office visit. As mentioned before, it allows for an objective assessment of what substances are or are not present in the biological specimen. Testing can be a part of a risk mitigation and harm reduction strategy to help intervene in a positive way when a patient shows signs of non-adherence or non-prescribed or illicit substance use. Also, knowing whether or not a person is ingesting their medications can help avoid potentially unnecessary and costly modifications to a treatment plan that could be incurred with prescribing additional medications or utilizing additional tests or other treatment approaches. Once received in the lab, Aegis reports results within 72 hours, and our clinical team is available through a dedicated phone line and email for interpretation support. Providers have complete flexibility to order test selections according to their determination of medical necessity. A mental health profile and a substance use disorder profile is offered, and providers may choose either profile with or without additional tests or simply an a la carte selection of tests. The goal is for providers to be able to choose the test that will provide them with the most appropriate insight into their patient's treatment adherence. This is an example of what a report might look like depending on the prescription information provided, depending on what tests are ordered and what results are obtained. In this particular example, the patient is compliant with prescribed gabapentin, trazodone, paroxetine, and promethazine, but they also have ingested non-prescribed hydrocodone, or at least it was not indicated as prescribed on the requisition. Also, this provider has elected to order drug-drug interaction testing, which has identified several pairs of interacting substances, some including drugs that were not part of the medication adherence testing. So InteractRx is an add-on test that is available. I would encourage you to check out other webinars that have been presented by our clinical team that are available as recordings on our website, which discuss drug-drug interaction testing, which is called InteractRx, in much more detail. When utilized appropriately, InteractRx can provide additional insight into possible causes of side effects, if the patient is saying that their medicine is not working well for them, or if the patient is continuing to need dose increases to maintain efficacy. Patients with mental illness may have increased risk of drug-drug interactions. 72% of patients with depression have a comorbid chronic condition, which means potentially additional medications that are needed to manage that condition. And also, 23% of patients with schizophrenia are exposed to drug-drug interactions. Many psychotropic medications are prone to pharmacokinetic and pharmacodynamic interactions. If one medication affects the metabolism of another, or one medication adds to the effects of another, creating a cumulative effect, this can lead to a negative outcome for the patient. These negative outcomes can include treatment failure, drug toxicity, hospitalizations, and medication non-adherence if the patient figures out that avoiding certain medications can help relieve them of those side effects. While multiple medications may be clinically necessary to manage multiple comorbid conditions, testing for interacting medications may help fill in information that could be missed in traditional medication reconciliation and review. Another testing tool that can provide further insight into the treatment of patients with behavioral health diagnoses is testing for novel psychoactive substances, abbreviated as NPS. NPS is somewhat of a vague term that's used to describe a diverse group of synthetic substances created to mimic the effects of scheduled or illicit drugs. However, they vary in both toxicity and potency. There are several classes of novel psychoactive substances out there. There's synthetic cannabinoids, synthetic stimulants, designer opioids, designer benzodiazepines, hallucinogens, dissociatives, and others. So, with all of these, an important point of reference is that a substance only needs to be newly observed to be considered novel. The chemical itself may have originated from research long ago. These drugs can originate from original developers of drugs that were working toward the prescription market, and then the chemical does not make it to market. So then it is modified or diverted to the illicit market for whatever reason. And then in some cases, there are clandestine chemists who take formulas that are published in scientific literature or manipulate the structure of known molecular entities to either avoid the controlled substance regulation around that known entity, to enhance the effect, and also to avoid detection by traditional toxicology testing. These substances can come from a variety of places. They can be prescription drugs in other countries in some cases. And in a few cases, they are veterinary prescriptions, so approved for animal use, but not approved for any human medical use. Patients can be exposed to these substances in a variety of ways. One is purposeful exposure through direct purchases, which can take place in a variety of ways. In the case of the unregulated cannabinoids or cathinones, those are available in brick and mortar stores in some cases. A lot of these are available via the internet. They can be delivered to a physical address via traditional shipping methods. And one trick that is sometimes used is for someone to send the package to an innocent person's address to try to avoid suspicion, and then they'll track the package to arrive at that other location and intercept it before the physical homeowner realizes that a package has arrived. On the internet, these chemicals tend to be referred to as research chemicals or labeled as not for human use to be able to sell them on that forum. Then, of course, there's traditional street dealer networks. These come in through Central and South American drug smuggling sources. In many of the cases, the originating source is still from overseas. They just flow into the U.S. through these traditional intermediaries. The ultimate use in many cases is an unintended exposure to a drug through something like a counterfeit drug. Patients may knowingly purchase something knowing it's a counterfeit drug, or they may truly believe it is the prescription drug that the counterfeit has been designed to mimic and not realize that it's a counterfeit. Aegis offers testing for many NPS in those categories that I was describing. These can be ordered by class according to the provider's determination of medical necessity, so any combination of classes can be chosen. If there is a concern that an individual may have transitioned from misuse of one substance to a substance they believe cannot be detected in urine or oral fluid, NPS testing can help identify that use and help get the individual back on track with their treatment. Also, NPS use can explain potentially new behaviors that do not seem to connect to the patient's diagnosis or to their current medications. Side effects of NPS may also be cumulative with other prescription medications, with combinations that can lead to increased risk of overdose and other adverse drug effects. Again, this is another example report just to show that testing for the right substances can provide additional clarity regarding the patient's presentation that might otherwise be missed. With knowledge of recent NPS use, the patient can be educated on the dangers of counterfeit pills, the unpredictability of the illicit drug supply, and the possible cumulative effects of combining multiple prescription and illicit substances. The results are not intended to be punitive, but rather to provide a more transparent view of the individual substance use and their treatment adherence. This is one more testing tool that can complete the assessment picture as well. Biodetect testing assesses for the presence or absence of unique biomarkers that show consistency with human urine. When these are absent, even in the context of normal creatinine and normal pH levels, a synthetic urine product could have been used in place of human urine. Individuals may take it a step further and attempt to add prescribed medication to the sample to try to mimic a compliant result, but it can be very difficult to properly assess medication adherence with a substituted specimen. So, again, the results are not intended to be punitive, but rather to inform on potential changes in risk and the need to possibly consider a different form of monitoring, such as oral fluid testing. As we wrap up, the key messages we discussed today are that objective measurement of recent ingestion of substances is available in urine and oral fluid. This information can assist in differentiating between non-adherence, treatment failure, and symptom progression. And when utilized appropriately, additional definitive testing tools can assist with clinical decision making. Our clinical team is ready to answer any questions that you may have. You can reach us by phone or email as noted on your screen, and we truly do welcome your questions. We want to help simplify your use of toxicology testing so that you can focus on the benefits it can offer with helping with clinical decisions. Thank you all so much for your time and attention today, and this concludes today's webinar.